on school reopening and hearing teachers' voices. Today we are going to hear from two teachers, one from Malawi and another person from Liberia. Both countries' school reopening experience has been monitored. And okay, I did not introduce myself. My name is Yumiko Yokozaki. I'm a director of UNESCO International Institute for Capacity Building Africa. We work on the teacher development. We also work very closely with African Union and the CESA, Continental Education Strategies for Africa. So we would like to know and would like to share our experience on what is happening in school opening in Africa. So that is our webinar's theme. Before we start the keynote by Dr. Rita, I'd like to briefly share with you our program. Now, we have a keynote by Dr. Rita, director of IICBA, based in Burkina Faso. And then we will have a panel discussion joined by Mr. Samuel Johnson of Liberia, Mr. Charles Kamchenga of Malawi, and Mr. Saliu Salu of IICBA. And then afterwards, we have a questions and answers, and we go on. This is a relatively small webinar, so I think we can have a very good interaction. So on this note, I would like to invite Dr. Rita to give a keynote remarks. Rita, over to you. Thank you. Okay, before that, sorry, please switch off your microphone, and when you're not talking, please switch off your video and microphone. And also, if you have a questions and the comments, please use the chat box. Thank you very much. And over to you, Rita. Thank you.
So good afternoon, ladies and gentlemen, representatives from Ministries of Education, school leaders, and all guests. What a pleasure to be here with you today, to this afternoon or this morning, depending on which part of the continent you are. And allow me to take this opportunity to thank Dr. Yumiko and her team for inviting me to this webinar. So I will be talking first of all, as head of the African Union International Center for Girls and Women's Education, but also as a parent about the school reopening. We know that with the COVID-19 pandemic, over 250 million primary and secondary children have been out of school in our African continent. And I want to talk more about girls. How do school closures affect girls and women in many ways, more ways than they do for boys. And often they harm girls in long-term consequences. We know already that our girls face a lot of barriers to accessing education. This, of course, ensures substantial gender disparities. Our girls and women are often exposed to abuses, as we know, child marriage, female genital mutilation, which ends their education abruptly. Schools are a haven. They are safe spaces for our girls and young women. They have not been in school for the past couple of months. And the likelihood that those girls and young women get married or abused sexually is much higher than when the schools were open. During this pandemic, our schools have not been there to protect our girls and women. And of course, it has put them at higher risks of sexual violence, exploitation, trafficking, child marriage, forced labor, and social exclusion. Ladies and gentlemen, at a time when we're talking of reopening of schools, our assumption is that learners have already been able to achieve their school year successfully. This is what we are all assuming. And they have gained, according to us, the competencies related to their grade, because we know that all the children who will now be starting the next year, as in most cases, everybody will go up another grade. There will be no one who will be lagging behind. So we are assuming that all the competencies have been acquired. As we are aware, most of our countries, and this has been said during the AU, the STC, that is the meeting with our ministers of education, of science and technology, that all our member states have ensured to give continued learning, whether they have used TV, they have used radio, or whether they have used digital online platforms, they have all tried to ensure continued learning. And in some cases where they have not had the possibility of having mass media, some countries or some schools have even delivered learning materials or learning resources in homes. However, we know of the problems that we face in our continent. I start first of all with radio and TV. Not all our households, especially the poor households in rural areas, do not have a TV or do not have a radio, or if they do have, they might have one. And if you have a couple of children, how do you access this? How do you access the TV or learning program that is happening? Everything is happening at the same time. We come to the online learning platforms. How many of our houses, of our homes in our continent have access to a computer, have connectivity, have electricity? So we cannot assume at this moment that our children have been able to achieve the competencies that they would have had if they had had face-to-face learning. We should not forget our teachers. I think we really need to congratulate our teachers. We really need to say big bravo to our teachers. Teachers have tried as much as possible to ensure continued learning with the means which have been made available to them and in conformity of what was expected of them. I mean, I personally, as a parent, would like to say that my children have had online schooling, and I'm very grateful for what the teachers have done. And I'm sure that many of you as parents are grateful if your children have had the opportunity of having continued learning. However, I think much of what has been done during COVID by our teachers still remains undocumented, not always recognized. And I think this is something that us here as a group, we need to ensure that they are recognized, that we make sure that they are saluted for all the efforts that they have made. I know many teachers in different countries who have told me that they have no idea how to put a program, a course online. They have no idea how to do it. They have been forced, let us say inverted commas. They have been asked by their head teachers, by their directors to put the courses online. They have tried as much as possible. It has not been easy, as we all know. Now, while the shutdown, we are thinking that the shutdown is a temporary out-of-school problem, but it might become permanent for some children, especially older ones who have had to go to work due to so many reasons. I mean, their parents are thinking they are elder ones, they need to bring money in the house. So they have joined the job labor market. So this will add to the already so many millions of children who were already out of school before the pandemic. And I think another big issue is that school services, ancillary school services such as school meals, sanitary pads, have been disrupted while our schools have been closed. So this again has been another big problem that we have not been able to solve. Ladies and gentlemen, our African countries are at different stages regarding on when and how to reopen their schools. Ministries are considering about the issues of public health, the benefits and the risks for education and other factors. But of course, at the center of all this thinking, of all this consideration is the learner. The learner has to be at the center of the thinking. We have to use the best available evidence to make sure that his or her interests are taken into account when we take decisions. Our teachers have a key role to play. They are the ones who are going to be able to ensure that social distancing and health measures are respected in schools. And I can also vouch for that. My children have returned to school in June. And the teachers, there were only classes which were half classes, and the teachers made sure that the children were wearing masks, that the tables were properly set, that there was 1 meter apart, and that during break time, not all the children were crowding up together. But as you can imagine, it is not an easy task. Another big problem is that our school administrators must make sure that our girls and our women go back to school. And as the IICBA, as the African Union International Center for Girls and Women's Education, we are right now working on a campaign to make sure that our girls go back to school, because so many girls will not go back to school because either they have been forced into marriage, some have got pregnant, as we saw during the Ebola crisis. The rise of pregnant young women was really high. Some because they have stopped their schooling, it will be difficult to get back into the system. So we have to make sure that ministries are tracking or will track the number of boys and girls who will get back into the system and how have they been affected by the school closures. And we need gender disaggregated data to see if there is a significant amount of girls and boys who are returning to school. Schools are also having catch-up lessons to bring students back to school. These are sometimes refresher courses, some are remedial courses. I know that in the school of my own children, right now it's the vacation, and they have special remedial after-school programs even during the holidays, and assignments to do during the holidays. And given the fact that many schools, we just heard Gertrude from Uganda who said that school might not be opening up in September, we have to think of the possibility of having maybe blended schooling, because school, I think it will be difficult at this time to open full-time. As we have seen in South Africa, the numbers are not going down. We are now talking of a second wave. So we can talk of a teaching and learning process where we have half face-to-face, half of the children face-to-face, and half having it online through mass media or TV or etc. But every country, every school, district has to decide what is best based on their own context, based on their own situational analysis. Some schools are even thinking of totally replacing this face-to-face teacher and student interaction and regular activities with just having no contactless interaction, exchange of learning. So we come back to full face-to-face as we have been doing right now. Of course, again, teachers have a lot of work to do. Teachers will have to prepare the reading lists, will have to prepare the assignments, and children will, of course, have to do their daily tasks, submit assignments, and the school becomes a sort of exchange for those teaching and learning processes. Based on the different grades, learners can be allotted different times to avoid overcrowding and improve social distancing. But of course, we have to ensure that learning happens. And the learning that happens is a targeted learning. I think, as I said again, we have to look at the reality on the ground. And I said again, there needs to be remedial lessons, remedial classes for children, for learners who are lagging behind. I think at a time when we are talking of not fully reopening, can we think of only concentrating on some core academic subjects, such as maths and the languages such as English, French, Arabic, and Portuguese? And what our teachers then become, they will help in the learning process, the other teachers. They can act as assistants. And we can also think of recruiting assistants, volunteers, to help teachers in implementing school plans and help in the assessment process. Children do not have to go full-time at school. They can go on a part-time basis. And of course, there will be a lot of adjustments. This approach, of course, does not prevent, of course, from not having digital online platforms. This is, of course, possible in some cases. And I think with this, if we do set up part-time schooling, then we can also have those ancillary school services, which I talked about, such as school meals, sanitary pads, which have been lacking for the past months. I know this is not an easy situation. As I said, every country, every school will have to see what is best for them. And what has also been a big question is that when schools reopen, as parents, do we send our children back to school? I myself, as a parent, I opted to send my children to school. The reasons I did was that because there is a routine at school, first of all. Secondly, school is also it's a part of the society. How long are we going to be closed? How long are we going to live in this cocoon? This is a personal decision. Anyway, everybody has their own rights to decide what is best for their own children, what is best for their own region, what is best for their school and for their own country. I do hope that this meeting we will be able to discuss other avenues concerning school reopening in your different countries. The safety of our children is at stake. Thank you very much for listening to me.
Thank you very much, Rita, for a very insightful comment. I fully agree with you that the school reopening is not possible without a capacitated and motivated teachers who know exactly what to do to protect the children, and especially protect the girls even more, because they have already been very much disadvantaged during the school closure. I forgot to mention that Dr. Rita heads the Center for Advancement of Girls and Women's Education in Africa. So what you said about girls and the sanitary pads and so on really are very important issues for you and then for us all. Now, thank you very much for joining us in a busy schedule. I am really grateful. We might have some questions and so on. I know you have to leave in a few minutes, but stay with us and we will hear from teachers now. Now, because of our connectivity, unfortunately, Mr. Machungwe from Malawi could not join. But Mr. Samuel Johnson, are you there? Okay, if he's not there, we go to the third panelist, who is Mr. Saliu Salu, who can talk about the situation in Senegal. And then I see Mary from Kenya. Maybe she could make some intervention on behalf of the teachers, and also Mr. Petty. But anyway, I will send the microphone to Mr. Saliu Salu. Over to you. You have 5 to 7 minutes to discuss. Thank you.
Thank you very much, Yumiko. Thank you, dear participants. And really, we are very pleased to welcome you in this webinar. Actually, I'm going to share with you a testimony from a teacher who is from Senegal. Senegal, by the way, which is my country also. In Senegal, the authority decided to reopen school on the 2nd of June. But unfortunately, on that very day, many teachers got infected in one region. So the authority decided to close the school again and to program another reopening, which was on the 25th of June. But there is a teacher who sent a testimony in the newspaper, which I collected, and I'm going to read you the testimony all the way. On Wednesday, June the 3rd, around 10 a.m., I just took a bath after a good morning wake-up call. One of my colleagues came to me and told me, "My friend, let us prepare for a possible quarantine. because Mr. X spent half of the night in the health district. I am afraid he's got the virus. So during our conversation, a lady pops in and says, "Hey, don't say this here. It may not be the corona." This was a long and difficult day for all of us and plunged us into the abyss of doubt and uncertainty. But the worst thing to me is the teasing nickname that our students would make for us: Corona House, Corona Teachers. That same day, at 8:05, just after the evening prayers, my colleague came to confirm that our colleague is finally tested positive. He was probably contaminated at the bus station from Dakar, where the teachers were gathered to be transported to different places all over the country. At 10:39, my phone rings and I picked up. My interlocutor is the chief medical officer of the health district. "Mr. Juf?" she asked. "Yes," I replied. After the greetings, she calmly tells me to stay at home and respect the barrier measures because our colleague with whom we share the food is tested positive. A quarantine sounds bad in my heart, but I had to be strong because it's a divine ordeal that must be faced. A few hours later, around midnight, a hygiene disinfection team arrives at the house. Our rooms, our toilets, every corner of the whole house are disinfected. The whole show unfolds in front of me like a fiction. As the machine was purring in our apartment, I retreated from the crowd to imagine the feeling of the infected colleague. I thought to myself, surely his soul will cry without tears for being the victim of an error. In the same minute, I hear a mother next door saying, "My God, Mr. X will feel more the pain of stigma and prejudice than that of the disease of this satanic corona." I add whispering, "You are right. The stigma will be more symptomatic than the fever itself." Since our rooms were disinfected, we decided to spend the night outside. Suddenly, around 4 a.m., a medical team arrives at our house for the purpose of the test. Nothing is more difficult to pass this test with this cotton swab that runs to the bottom of the nose. 19 people, subjects all of probable contacts, were scrutinized pending the results in a period of 24 hours. Quarantine or self-imprisonment. As the result of the tests carried out, we are quarantined at home, night and day, locked ourselves in. We miss the outside world and will inevitably be missed. After 2 days of confinement at home, only meals bring us together because everyone locked themselves in their room. I say to myself, so much the better, because my television and my smartphone will serve as companions, which was a total illusion because human warmth is irreplaceable. I miss the discussions and the exchanges, especially those with my joking cousins, another ethnic group. 2 days of confinement pass hard until a glimmer of hope appears in the evening of Thursday, June the 4th at 11 p.m., telling us that our first tests were negative. That Thursday is the only day I wanted to be negative in my life. So a wind of release blew into the house. Finally, we are positively negative, even if the fight against hygiene measures and barriers will probably continue for up to 14 days. Now, the after effects of the virus or social stigma. Since Wednesday, June the 3rd, We are making news in the area, and wherever the news is transmitted, thanks to the genuine of clicking. Our students, our parents, our colleagues call us from all over to inquire about our situation. One of my students told me via WhatsApp on Friday, "Sir, don't hesitate to ask me anything you want, credit, connection, or other needs. We are here for you because you came here for us." A few minutes later, my phone rings, a message. After consulting the message, it's a deposit of 5,000 CFA or via Orange Money, via the telephone. Before just dropping my cell phone, a WhatsApp voice sounds. "Sir, I sent you this money. I listened. I just smoothed drops of tears that fell in spite of me before calling him and saying, 'Thank you, my dear students.' This gesture is probably one of my greatest consolations of the day. In addition, other students whose phone number I have are now my links between the house and the shop that supplies me until the end of the month. When they arrive at the door, they just beep me. I go out with my mask and ask them to put the supplies on the floor. On the other hand, others are pouring in gratitude stigma as everywhere else. Why come here knowing he's sick? Why does this teacher come here knowing that he's sick? No, boy, you're screwed. Corona at home? No, it's all because of our president. What some in the village, whose echoes reach me via WhatsApp and other channels. So many questions and exclamations emanating from the local population who are afraid to live with the virus. For the next reopening of classes, I imagine how our students will welcome us with the popular psychosis that does not deserve its name. After 4 days in the quarantine basket or dustbin, I have just understood some weak spirits who were fleeing the quarantine premises because this prison, between quotes, requires a battle against the aspirations of the soul. Go out, discuss, play, entertain, in short, be free. In any case, this prescribed prison is a personal responsibility to protect the community in which we live. Finally, I cannot finish this story without wishing my dear colleague a double recovery. Be physically and psychologically healed, my dear. Come back to us faster. We are waiting for you at home to apologize, job, and continue the good life. Get sick from COVID-19 is not a change. So this was, in a nutshell, the testimony sent by a teacher who was present during the school reopening, the first school reopening, and whose colleagues was tested positive. So thank you very much. Maybe if there are some questions, I can answer according to the information I have received. Thank you very much.
Thank you very much, Saliu. This was a truly moving voice from the teacher in Senegal. So teachers who know what the COVID-19 is, I am sure he will be the best protector of students when the schools reopen. Now, we are still waiting for Mr. Samuel Johnson from Liberia. He's having a problem in connecting. But I see Veronica and Teddy from Education International. And I'm wondering if they could represent some of the teachers' voices. Dr. Petty, are you there?
Yes, I'm there. Can you hear me?
Yes, very well. Thank you.
Okay. I'm having some internet challenges here. It may come on and off at times. Good morning, everybody. Thank you, IICBA. Thank you, Dr. Yumiko, for organizing these webinars. And I think this is one of the webinars that matches very well with the perspective of Education International, which, as you know, is the voice, the global voice of educators across the world, mobilizing teachers through their unions. As most people said just before me, this COVID pandemic has put us in a very strange position, especially in the education sector. We have never learned to do our job in these circumstances. And just like many other testimonials before, it just took the educating community by surprise. And in that context, everybody, government and teachers as professionals have been trying to find ways on how to tackle the situation. Now that governments are reopening schools, at least for exam classes, we have been in contact with our affiliates across the world and especially in Africa, and some of them have reported situations pertaining to the reopening, challenges connected to the reopening of schools. Just before that, EI had a forward thinking and developed a series of guidelines to guide the reopening of schools. We call it the back to school movement. The directives come in 5 stages. Number 1, EI is advising its affiliates and governments to undertake social and policy dialogue so that whatever decision is being taken in connection with the reopening school is done in consultation with teachers as professionals. The second directive is to guarantee the safety of the education community. And I think I have a few short stories to share about this. In some countries, if you allow me to keep the names quiet, in some countries, when schools have reopened, during the first week, there were cases of contamination of students that have been reported. Luckily, the government in these countries, at least those that have been reported to EI, government have taken quick decision. 1, to quarantine immediately all the students that have symptoms of and that have been tested positive of COVID-19, and then proceed to a systematic testing of all the community in the schools. And we thank that initiative. Let me go to the third directive. We have realized also that the pandemic has affected the teaching community as a whole, but it has affected mainly women more than men. I may not be able to give all the details here, but because of that realization, the third directive of EI is to put priority on equity in whatever solution we are looking for to curb the pandemic. The fourth directive is to ensure the physical and emotion that as teachers are going back to school, we should ensure to give them physical and emotional support. And this is where I would like to agree with the speaker that came just before me.
Hello, Dr. Petty. Hello? Hello, Dr. Petty. Aha. I think he is off the line. He did tell us about the internet, the challenges from Accra. So while we are waiting, I'm wondering maybe I should invite the next speaker, who is Mr. Pililani Kamaliza. Mr. Pililani Kamaliza, can you hear us? You said that you are representing Malawi. Hello? Hello? Okay, is that Mr. Samuel Johnson from Liberia? Hello? Hello? Dr. Samuel, Mr. Samuel Johnson, can you hear me? Hello? Samuel, Mr. Samuel Johnson, can you hear us? Okay, while we are waiting, I think Dr. Peddy is back. Peddy, can you hear us now?
Yeah,
Please
yes.
continue. Thank you.
Okay, thank you very much, Yumiko. Sorry, I was talking, thinking I was on the meeting. Good morning, good afternoon, depending on the time wherever we are. Greetings from the Education International community. I am Pedi Anawi from the Education International Africa Regional Office based in Accra. Just to share a few things, initiatives that EI has taken in connection with the back to school movement.
Dr. Peddy, we heard you talking. Yeah, we heard you talking about back to school, and physical and emotional support, and then you disappeared. So would you like to continue from there?
Sorry, that was the fourth directive, and the fifth and last directive was to trust teachers' professionalism, because we think that, as we have seen in many countries, government will just take the decision without or with just little consultation with teachers. And we think that teachers are professionals and they should be consulted so that they That's all. And I thank you very much for this initiative.
Thank you very much. Thank you very much, Dr. Peddy, for your intervention. It is wonderful that EI is supporting teachers on these very practical issues. And also trusting teachers is a very important issue. Now, I see Mr. Samuel Johnson. I'm wondering whether you could share with us the teachers' views from Liberia. Over to you. You have 5 minutes.
Sorry. Hello?
Yes, we can hear you very well.
Okay, sorry, we've been having serious challenge with the internet. Our team just came to assist. Well, we've been having some challenges with the reopening of schools. The Ministry of Education requested that all the 12th graders, because of the West African Senior Secondary School Certificate exam, should resume classes as of June 29th. But the workshop that was conducted by the Ministry of Health and the National Public Health Institute never went across the country to the 707 senior high schools. Mostly were concentrated in Monserrado and Maggie County where workshops were conducted, unlike the previous information that was passed on after the schools were closed for the teachers and parents and students to observe the health protocols, constant washing of hands, using nose masks, and keeping social distances. So we have been following these protocols, calling our members across the country to make sure that they follow these protocols to remain safe, because it will be, we already have challenge with the number of qualified teachers across the country. The qualified ones that are available, the students are more than the qualified teachers. So if anything happens to any of them, it will surely affect the education sector. So we have been encouraging them to observe the health protocol, to go by the school, teach the students to observe the rules and regulations, the federal health protocols, where there are nose masks constantly, keep the social distance in the school, both in and out of the school campus, and to ensure that those essential materials, because the time is very short for instruction, those essential materials that are relevant for the WACS exams are taught, so that in August, when the students go for the exam, they will be able to make a successful pass. These are some of the interventions. We've been helping them with some food stuff, hand washing materials. When the virus started, the first lockdown, NTO were the first to provide hand washing material to all the 28 district education officers in Monserrado and the 2 county education officers, along with the 6 district education officers in Magibi and the county education officer, because those were the 2 counties that were highly affected at the time when the first lockdown was pronounced by the government of Liberia. So we were able to identify with them. We started before even the government started sending some assistance to the teachers. So we are very concerned about our membership. We want to make sure that it remains safe, the students, the parents, so that we will together will fight to eradicate this virus from Liberia and resume our normal school system. But right now, from 11th grade downwards, the students are staying home. We are still discussing with the Ministry of Education. Unfortunately, the Minister Papa and the Deputy Minister for Administration were sick. They were admitted. The Minister Papa came down with a virus, and the Deputy Minister had some medical complication. He was flown to Ghana for further medical treatment. That was not COVID-19. He had other extra medical problems that needed external treatment, so he was flown to Ghana. He's still undergoing the treatment. So the Deputy Minister for Instruction is in charge of the ministry currently. Hello? Hello?
Yes, we can hear you, Mr. Samuel Johnson.
Yes.
How are the teachers?
Yeah.
Go ahead.
Yeah, so far, those are the major events. If there's any other input, when I'm asked, I can be able to provide further information. Send the time is 5 minutes.
Okay, thank you very much for sharing with us how the things are in Liberia. I am really grateful that Teachers Union is supporting teachers in the pedagogical issues as well as the practical issues like hand washing materials provision in schools and so on. I am wondering, there was a teacher representative from, thank you very much, Mr. Samuel Johnson for Liberia. There was a Malawi representative. Are you there? Are you ready to talk? Hello? I cannot hear, we cannot hear you very well. Can you speak close to the microphone?
Yeah.
Mr. Kirani Kamaliza.
Was clear. I got good explaining so that Malawi.
Mr. Samuel Johnson, would you like to mute your microphone? I think your microphone is still on.
I should call it off.
Yes, please switch off the mute your microphone, but I would like you to stay because we will have some questions for you later.
Okay, all right.
Yes, please stay with us. Please stay with us, but mute your microphone.
Hello.
Okay. If Mr. Kamaliza is not available, Veronica, are you available now? Veronica?
Hello.
Mrs. Veronica Ano?
Yes. Hello.
Hello.
Dr.
Yes,
Yumiko.
please.
Okay. Thank you very much for giving me the floor. But what I have to say is to touch on or continue with what my senior colleague, Dr. Pedi, have shared with members. So, and I can only speak specifically to Ghana. So, yes, we have schools have reopened, but it's in phases, and it's for the final year students who are preparing to write their examinations. So that is GHS 3 students, SHS 3 students, and then final year students in the tertiary educations. And for particularly this week, some schools have reported students being infected with the disease, and parents and both the students are agitating that they should allow the students to go back home to their parents for treatment. I really don't know what the government or the Ministry of Education has come out to say regarding this. I haven't seen any communication from them regarding this yet at the moment. But for now, they are still in school. Those in the boarding house are still there. Government hasn't released them to go back home to their parents, in spite of the fact that some of the students and even the teachers are contracting the disease. And like I said, I don't know what they are planning to do regarding this. And so this is the situation for now in Ghana, and that is what I have to say regarding it. They claim they have, as in government, they have put measures in place, but it's not enough. It's not adequate for them. I wonder if there were good measures in place. I don't think some of the students would have been contracting the disease. And so we really don't know what government is planning and what they have to say regarding this issue in the coming days or weeks. We don't know if they still would continue with the students to write their exams or it will be cancelled. We really can't tell as of today that I'm speaking in this meeting. So that is what I have to say for now. Thank you.
Thank you very much, Veronica, for the situation in Ghana. You are absolutely right that schools had to open, especially for the examination classes. But but sometimes they close it back because of the increased infection and so on. And I can imagine that how nervous that students, parents, and the teachers are. So we really have to provide the knowledge and the skills to the teachers. So that's something we can do together. Now, I would like to move to question and answer now. I think our colleague, Dr. Binyam, has been monitoring the chat, but maybe he will open the floor, or he will have some questions for you. So, Binyam, are you ready? Can I pass on the microphone to you?
Yes, Yumiko, I am. Can you hear me?
Yes.
Okay. Thank you very much, colleagues, for all the insightful presentations and the discussion points that you all have raised. I think we had a great contributions from Dr. Rita on how school reopening could affect what the situation is like on the continent, but also how it could affect girls. And we had a great testimony from Saliu, one of our own here, our program officer in IICBA, from a teacher in Senegal. And then we are also glad that we have heard from Mr. Samuel on the situations in Liberia and the teacher perspective. And, great contribution also from Dr. Pedi and Veronica, how Education International is supporting member countries on school reopening. I think I would just like to start by, as a parent myself and a father of two daughters, one of them currently in a kindergarten and moving to primary school next academic year. As a parent, I think it has been, the last few months have been difficult trying to homeschool the kids, and also worried about the overall situation. So I think personally, just to have one or 2 points with regard to that, I'm glad that now we're looking to the future and trying to see how school reopening would look like, at least in the coming academic year. Safety, as a parent, I think safety is a huge priority for all of us. It was also mentioned earlier. So the famous saying, safety first, is a key point for all of us. I think as a parent, as a teacher, for all of us, that is a huge priority, and we need, when schools reopen, we want to make sure that schools are safe for the children, for the teachers, for the school leadership, and for the community in general. Because if students contact some of the virus, then they carry it back to their families and to their community. So that is a huge priority, and we need to make sure everything in our power that safety is children are safe. But at the same time, an important aspect of this is we know that children want to learn. They need to learn, and they must continue to learn. And for that, it's one thing to try to homeschool and to try to adjust distance learning and all of that. But that face-to-face learning is also an important element of their socialization, their learning. So understanding and the context, what we are in, it's very important that we have now taken a lesson over the last few months, how dangerous the virus is and how it could transmit, and what we are able to do and what we are not able to do. So we are expected to come up with a creative strategies that to get students back to school. And I like some of the suggestions that were made by Dr. Rita, for example, a part-time schooling and the blended schooling, and several creative ways can be taught out. And I think as a parent, we all feel safe if there is some way strategy is put in place. Having said that, there are a couple of questions on the chat box, especially I think there was a question about it's very important that schools are reopened or plans are being made in some countries, but an important question to take into consideration is, are teachers provided with the much needed knowledge and skills for reopening in schools in Senegal, in Liberia, in Ghana, and elsewhere? So are they given that knowledge and skill? Additionally, are they even consulted? Are they consulted? Are they, about these issues? So that's one important aspect that colleagues could comment on. And as a second issue is, was there, when schools were reopened, is it just going back to the old context, or were there no new strategies? For example, some of the strategies that Dr. Rita mentioned to try to part-time schooling and to have some innovative and creative strategies. So were there any creative, innovative strategies that we can learn from each other? So I pass it to colleagues to one comment on if teachers were consulted or they have been provided with any knowledge and skills for school reopening. Second, were there any innovative strategies that were made, which is contextually relevant to us? So probably I'll pass it to Mr. Samuel Johnson first, if any comment with regard to these points. Mr. Samuel Johnson, can you hear us? Can you briefly comment on these 2 points?
Hello?
Hello, Mr. Samuel Johnson. Yes, we can hear you. Can you briefly comment on the 2 points, please?
Please repeat the 2 points. I didn't get that clear. The network is fluctuating.
Okay, the first one was, were teachers consulted about school reopening, and were they given skills and knowledge about school reopening? The second one was, were there any innovative, creative strategies that were put in place that we can learn from each other?
Well, unfortunately, the Ministry of Education that represent the government have been doing most of the thing in isolation. They only go on the radio and make pronouncements. Since the restriction was placed on public gathering, most of the communication received was through the radio. Sometimes they send email to us. So only through the email we're able to get the information. Then we communicate. We have the telephone numbers of all of our 15 local branches leaders and the regional vice president. We communicate with them to put the announcement on the local radio station to inform the members. Well, most of them were complaining about the instructional materials. The only funny thing is the government have really been doing well in terms of salary remuneration. They have been paying constantly up to date. They are paid up to June. Even though there are other few teachers whose names were left out of the payroll, which we have been engaging in the ministry, but they are on a larger scale. They have been paying the members. So with that, they were able to obtain food for their family during the lockdown, and they were able to keep getting treatments when anytime some of their members are sick. But there was no formal meeting to really discuss the pros and the cons of reopening schools. That never happened because of the restriction of public gathering, because most of the things have been discussed through the web. Only through the web now we've been having a series of meetings. All the ministers and their staff were at home. Only a few staff used to go to the Ministry of Education. So those were some of the challenges we had.
Thank you very much, Mr. Johnson, for the response. Can I now pass to Dr. Pedi and Veronica. Any comments on the preparation and skills and knowledge of teachers, or any consultations that were being made, and also any innovative strategies that we can learn from? Dr. Pedi, over to you.
Yes, thank you very much, Dr. Binya. At the EI level, just as part of our effort to prepare teachers towards going back to school, you know, we are living in a context of solidarity. And we knew that many teachers will face a kind of challenge. And so we thought of putting an initiative we call Solidarity Fund, where the richer unions can contribute with some funds to help prepare the weaker ones. And in that context, many of our affiliates have developed a project meant to prepare teachers, to develop the skills of teachers, to prepare them for resuming schools. And we have had about 15 or even 20 proposals for the development of teacher skills to prepare them to go back to school in Africa. Well, I think even before that, unions themselves have taken upon the responsibility to develop some kind of program. First of all, to develop the resilience of their teachers in this crisis situation, and then to help them, as government were talking of distance learning, to help them develop some sort of skills for what we call a distance learning. And I can give an example, although it is not very successful from my point of view, the example of the Mali Teachers Union we call SNEC, which has been consulted in preparing, in mounting this distance learning through television and radio. And when we shared the experience, somehow, well, we say a crisis time, crisis solution. It was a solution for this crisis time. Well, so far, I think this is what I have to share with you on these issues. Thank you.
Thank you very much, Dr. Pedi. This is really a great initiative, the Solidarity Fund that you have just mentioned, and the effort that was being put in place by some of the unions. Veronica, do you have any additions to make? Veronica, any additions?
Yes, hello.
Hello, we can hear you, Veronica, now. Please go ahead.
Okay. So in Ghana, like I said earlier, one of our affiliates, that's NAGRAT, their vice presidents, they are all worried after a teacher tested positive, and they are saying they are fearing, they are scared for their lives, especially because there is no testing systems available in the schools, and so they kind of lack the concentration to do their work as a result of the incident. Especially now that both teachers and students are getting involved. So I think the Ministry of the Ghana Health Service and the Education Service came out with a joint statement to say some teachers and even their spouses are testing positive. And so, I mean, there's this fear, that there's this members are uncertain about their health, especially now that government indicated that the mass testing in schools is impossible. Yeah. So we don't know. Like I said, we don't know what's going to happen in the next few days or weeks or months. Yeah.
Thank you very much, Veronica, for that intervention. I now would like to pass to Mr. Saliu Sal, our Senior Program Coordinator. Any comments on the two issues raised, Saliu, regarding the case of Senegal or other countries that you know about? Over to you, Saliu.
Yes, thank you very much, Binyam. I will not have to say much about those elements related to those questions, as I'm not living in the country, but I have some information, of course, that I can share with you. Drawing lessons from the first reopening, the authorities of Senegal have, tried to improve by providing some safety measures, consisting in providing students and teachers with masks. At least every week, every student or teacher have 3 washable masks. The physical barriers also will be respected, because I have to say that only the classes that are doing exams are reopened. That is the 6th form, the 10th form, and the 12th form, I think. Those who are doing their exam, only those are opened. And there is a distance that is made among students. I think 1.5 meters between one student and the other. Also, teachers and students are trained on how to use hand sanitizers and how to wash their hands. There is also a distribution of thermometers and hand washing materials, and so on. About the strategy, I think there is an intersectorial approach between many ministries: Ministry of Education, Ministry of Health, Ministry of Transport, and also the local community leaders. All those people develop a kind of synergy to take into their charge those teachers and those students. To give a concrete example about the measures, for example, there was a high school which was supposed to open on the 25th, but it could not open because there was no running water. And since the water could not be provided in a sufficient quantity, it was decided that that school would not open. It is the case also with some schools which don't have toilets and other sanitary equipments. So, for the time being, this is what I can share. Probably one of our colleagues who is Senegalese, who works in Mali, is attending the webinar. He can put some elements of it. In the name, Saib C, it is. Welcome, Saib.
Thank you, Saliu. Saib, are you with us?
Yes, Binyam. Hello.
Welcome. And any points to add to what Saliu just described?
Yes, I think only that what Saliu said, only that teacher is very important in this in the sport of reopening schools, but in much of the guide we see that teachers are not involved by the elaboration of the school reopening guide, and it will be very good to see how countries, Ministry of Education, have to involve teachers from the beginning to the implementation of the plan. I wanted to add only this point. For us is very important. We have seen that they can be very good to see how to avoid stigmatization, to avoid some quality of to avoid some difficulties on the implementation of this guide. Thank you, Binyam, and thank you for IICBA for giving me this opportunity.
Thank you very much, Taib.
Thank you, Saib. Thank you, Saliu. Yumiko, I see that Mr. Kamaliza is with us. Can we invite him to say a few words?
Yeah, I think so. Mr. Kamaliza, welcome back. Is your microphone working now?
Yeah, now I think I'm able to connect. Can you hear me?
Yes, we can hear you very well. Please go ahead.
All right. I'm Perilani Kamaliza, Programs Coordinator of Teachers Union of Malawi. Sorry for the poor connection I had initially. Greeting to everyone. In Malawi, as most of you are aware, the first time we registered 3 cases of COVID-19, our government, one of the actions which government took was to close all the public and private learning institutions indefinitely. So as of today, all learning institutions are closed. There's no school which has opened, that's primary, secondary, even universities. And after some months, the government had instituted a special presidential task force on safe school reopening. After there was an outcry out there that parents wanted their children to go back to school. And this task force was instituted to consult various stakeholders on the conditions under which schools should be reopened to ensure safety to both learners as well as teachers. And fortunately, as Teachers Union Malawi, the General Secretary was a member to this special presidential task force on school reopening. And consultations were made, and this committee had recommended to the government that schools should be reopened on the 13th August, 13th August next month, under a number of conditions to be followed. And you are aware that in Malawi, the political climate has not been conducive. We had the general elections, and which was nullified, and during this COVID situation, that's when the courts in Malawi had also ordered a rerun for the general election. So there has been a change in government, and this has also brought in some disturbances on when schools should be reopening. And as I'm talking now, I was just reading the report, the recent report about the pandemic, and it seems the cases have risen, and we are not yet sure now when schools will be opening. I don't think, based on what the comments I've read from the papers, I don't think schools will be opening anytime soon. Just yesterday, there was a press statement from the owners of private learning institutions adopting 13th August as a date to open the schools. But the government has also criticized that. I say, according to the current situation, where the cases have now started escalating, we cannot open schools anytime soon. So briefly, that's the current situation we are in. As Teachers Union Malawi, one of our much focused in this task force was to ensure that I think our members should be safe. When the government is considering for school reopening, the safety of the teachers should be taken into consideration. That's ensuring that the teachers are provided with basic protective equipment and also for the students. But apart from this, the government, with support from some developmental partners, are running some programs, online programs on the radio, on the TV, which of course is not reaching. I don't think it's reaching. I can say it's reaching even less than 30% of children in Malawi, considering that most of our schools are in the rural areas where the product of electricity and access to internet and TV is a problem. So there's that program which is running, which I think in terms of the number of students who are able to access such educational material is very limited. But I'm told just yesterday that the government is also considering printing some books to be distributed in the middle schools to ensure that they are given to the students, to the learners, to be able to read while in their respective homes. So briefly, that's the situation we are in here in Malawi. Thank you very much.
Thank you very much, Mr. Kamaliza, for sharing the situation in Malawi. It's been very useful and fruitful. Yumiko, do we have a few minutes for one set of questions?
Sure, please go ahead.
Okay, thank you very much. So there are no more comments or questions on the chat box. So what I can do is, I will just give the floor to one or two persons if there are any burning questions. Is there anyone who would like to take the floor for 2 minutes to raise a comment or to take a question? Anyone? Okay. I don't see anyone who is speaking, so probably I would just want to raise one more point, and the speakers probably could comment on it. One of the issues with regard to school reopening and how carefully we need to do it, and how we need to make it inclusive and we still keep quality of education, and the whole complexity is whether we are also taking into account the situation of those who are less fortunate, those who are less included, even under normal circumstances, because the situation becomes even worse for schools in rural areas, in refugee camps, and so on and so forth. So I was wondering if any one of you would like to come in and comment any considerations that are being made as we think of school reopening for those contexts where even under normal circumstances things were difficult and keeping the quality of education was a challenge. Are there any efforts being made to think of these particular situations? Probably Mr. Kamaliza, would you like to take floor for a comment?
Yeah, hello?
Yes, we can hear you.
Oh,
yes, go ahead.
Yeah, I think on that aspect, our government in their statement they have indicated that apart from reaching out to students through TV and radio education programs on core subjects, they also consider printing the braille materials to reach out to those students who are not able to, who are visually impaired students, as well as material for the teachers who are responsible for these students. Thank you.
Thank you so much, Mr. Samuel Johnson. Are you there? Would you like to make a comment on this? I don't see Mr. Samuel Johnson. And Saliu or Pedi, any comments on this point? Okay, Pedi, are you with us? Any comments?
Yes, I'm with you, Doug, but I have no specific comments. Thank you.
Okay, thank you very much. Mr. Samuel, are you with us? Would you like to comment if any preparations are being made to to consider those who are less included, like in rural areas, those with special needs, or in refugee camps, in our effort of school reopening in Liberia? Brief comment on that.
There are stakeholder discussion. There was stakeholder discussion ongoing until the Minister of Education came down with the COVID-19, and he has spent 3 weeks at the observation center, but he's recuperating. And the Deputy Minister for Administration too, who was coordinating most of the activity, got sick. They had to take him to Accra for further treatment, because he used to go to the United States for treatment, and because of the lack of flight, they have to carry him by way of road to Accra to be able to undergo further treatment, because the medical facilities were not available at the referral hospital here. So there are discussion ongoing for the reopening of schools from 11th grade downwards, even those with disabilities. They are discussed, but one of the greatest challenges is the hand washing. The sanitary materials are not enough in all of the schools. So parents and teachers, along with the students, have to improvise somehow to just keep everyone of us safe until this thing is subside, because the government is seriously challenged in terms of financial allocation for this COVID-19. They are overwhelmed. Most of the sources of income are not functioning now, so with these challenges, make it very difficult. But we are still working from the experience we have with Ebola. We are using those experiences to motivate our teachers to continue to engage the stakeholders at the community level to ensure that we succeed in reopening schools during the dry season, maybe around October to November. I'm sure by that time, because the virus can spread during the dry, but now we are at the peak of the rainy season. So hopefully we are hoping that after the rainy season subsides from October onwards, we'll be able to reopen.
Thank you. Thank you very much, Mr. Samuel. Thank you very much, colleagues.
Binyam?
Yes, Aliu? Yeah?
Maybe just to precise that in countries like Senegal, schools are not reopening at the same speed, because there are schools which are following Senegalese program, others are following French program, and those following the French program one, they say that they cannot reopen until September, because that they align with the decision of France. Another aspect is that, as a colleague said earlier, we are entering the rainy season, and many areas cannot be accessed. We cannot get access to many areas because of the rain. So this kind of jeopardize the atmosphere or the possibility of reopening all the schools. This is a worry that I would like to share with other colleagues. And I'm sure that is not specific to Senegal, but it is a reality that is common in many countries in Africa. Thank you very much.
Thank you. Thank you very much, Saliu. Thank you, colleagues, for your active involvement and participation. I now pass the screen to Yumiko for final words and to close this webinar. Over to you, Yumiko. Thank you.
Okay, thank you very much, Binyam, for beautifully organizing the. Okay, can you hear me?
Yes.
Good. Yes. So thank you very much for an excellent discussion. Now, I have just a few sentences to conclude. The COVID-19 and the school closure was an unprecedented event, and I think this is going to be written in the history of education, and not only in Africa, it was a whole world. And opening of schools vary. In many countries, they are slowly, timidly opening and then closing again. And we have seen some of the dangers, and so on. We have heard experiences from Burkina Faso, Ghana, Senegal, Liberia, and Malawi, where things are uncertain, but some achievements are made. And then we have learned a lot of lessons already. It was very good to hear from Education Internationals and the teachers, because they are the key for reopening schools. Now, we have some experience in reopening schools during Ebola crisis, but it seems it was much easier because Ebola was not as infectious as COVID-19. So we have some lessons, but we have to intensify our efforts. And one thing for reopening, there are a number of guidelines and rules and regulations. And we hope that the teachers must be consulted and be part of the solution rather than being told what to do. We should not leave anyone behind. And for that, teachers are very, very important. I have been thinking about COVID-19. It is a very political pandemic. Pandemic is by nature political, but the COVID-19 is probably more political than ever. We have just heard the president of Brazil was was tested positive, and now are getting a treatment. It can touch anybody, but we know that the vulnerable population is more at risk. And we don't know enough about this disease. We don't know the cure, we don't have the vaccine. So that brings fear and stigmatization in this disease. As Salil shared with us, the very moving experience of a teacher. We must rebuild better. We must be more hygienic. We must be more health-oriented, more information-oriented, science-oriented, and more equity, inclusion, and compassion-oriented when we reopen the schools. And the teachers have a lot to do. And IICBA very much would like to continue working with the teachers, bringing teachers' voices together, Education International and other entities with the teachers. So thank you very much for participating in this very interactive session. Thank you very much. We have another webinar tomorrow on early childhood and in early childhood for Francophone speakers, French language, at the same time at the 2 o'clock. So please do join us again. Okay, thank you very much. Let us be vigilant, let us be hygienic, let us continue washing our hands, and let us this social distance. I mean physical distance, but the socially connect. So thank you very much again for your participation, and have a good afternoon. Bye-bye.
Thank you all. Thank you.
Thank you. Bye-bye.
Thank you.